The annual health check really helped my son because I think he appreciated that a GP was speaking to him about his health rather than just his mother always telling him.
I think annual health checks are really important because it gives doctors a chance to find out how your health is, etc., and what they can do to help you.
It gives the young person or adult the experience of having the blood pressure taken, walking into a strange place, weight taken, all things sensory stuff that they're not used to. And little steps, it may be in 2 or 3 years' time, you're not dragging them there. They might actually feel quite happy about going and even going in without you. So give it a go. Don't just think it's not worth trying, because as a result of me persevering and me actually attending with my son, he's now got a formal diagnosis and he's a different person.
The annual health check is an annual review of the physical and mental health of somebody with a learning disability from the age of 14 onwards. It takes place at the local GP practice and the person is called in every year in order to ensure that they're staying well.
It's really important that people with learning disabilities attend their annual health checks. They're a really good opportunity for us to address any health problems or concerns that the patient may be having. It allows us to spot problems early and to address them thoroughly. The surgery will make reasonable adjustments to make the whole experience much easier. This might be having a longer appointment time, and usually carers or advocates are encouraged to attend. The appointment is designed to feel comfortable, supportive and focused on the person's needs. This ensures that people with learning disabilities get the same opportunities and access to healthcare as everybody else.
I was quite happy really because I was told that it was going to be a longer appointment, so I was happy that I'd be able to discuss maybe other concerning issues about Rowan that I had.
The Learning Disability Register is a confidential list kept by GP surgeries. It tells the surgery who may need extra support or reasonable adjustments and enables us to invite people for things like annual health checks. People on the Learning Disability Register will be contacted by their surgery each year and encouraged to book their annual health check. This will be done either by a phone call, text message or a letter. Some surgeries may send easy read documents first with information or questionnaires. They may approach carers directly and book the appointment with them. If someone hasn't received an invitation for an annual health check, they should contact their GP surgery to check if they're on the Learning Disability Register. If they're not on the Learning Disability Register, ask for them to be added. They will then be invited for their annual health check each year.
My first experience of an annual health check was with my daughter, and when we went to the surgery we saw a notice up in the notice board and it said about annual health checks. So checked it out with the receptionist and they said that somebody would contact us. So it wasn't long before the receptionist contacted us and said we should have one, and had no problem booking one in. And my task then was to inform Hannah what the detail of what an annual health check was. Hannah has a long history of complex health needs, so in terms of hearing that there was going to be another annual health check, what I aimed to do was to reduce her anxieties. What has been really important for Hannah is that it's always been the same GP. It's in a location that Hannah is happy and relaxed. In terms of anyone going for the first time for an annual health check, that's really, really important that they're clear about who they're going to see, that they're going to see them on such and such a time, such and such a date, and they're going to meet them at a particular venue.
I am happy with the relationship I have with Claire, and don't want anything to change.
When Ryan attends for his annual health check and I know he's going, I always remind him that he's going and we discuss if there's anything he wants to say, because this is his appointment, not mine. It gives you an opportunity for him to talk to the doctor about anything that's actually worrying him, and it might be something he doesn't want to tell me.
I think for me, it's always important I have someone next to me, because I feel that if I'm on my own, I get anxious and stressed out.
You know your young person or adult the best, and if there's something that's going to stress them out, you need to tell that member of staff when you book it. It's really no point in doing it when you get there. You need to say to the member of staff on the telephone that there's an anxiety about where they stand or where they sit, or they don't want to sit down, and then let them help you and tell you whether that day those arrangements can be made. And don't be afraid to ask for anything that's going to take the stress out of it.
My son was really anxious because they normally are. They don't like going into surgeries or hospitals. I know that he's into Formula Ones, he loves racing. So I said it's a bit like when cars go in for an MOT and they're going to check everything for you, and he felt much happier about that when I could relate it to his interest. We discussed this over a couple of days and he was at ease when he went in.
We check things like height, weight, blood pressure. We do a medication review, talk about vaccinations and cancer screening, and we'd also take the opportunity to discuss mental health and behaviour. We also talk about what's important to the person, such as sleep, staying active, eating healthy, and general well-being.
When my measurements were taken, we had a discussion about my weight and also how to eat more healthily and prevent my risk of diseases like heart disease and high blood pressure. I found that very helpful.
After the annual health check, the doctor will put together a health action plan. This is a clear, simple summary of everything that's been discussed during the appointment. It will take account of any health needs, actions to take, and advice from your doctor. It's written in an easy to understand format. It's also a really useful way of other professionals being able to share information.
Hannah found that particularly useful, so she was fully participant in that actual plan. I'm also very conscious that as a parent, I'm not going to be around all the time. She has got to take that responsibility, and hopefully with support in the future, she understands the importance of health and keeping healthy. It's about ensuring the person who's got the health needs is fully involved and fully active in managing their own health needs.
The doctor helped me to understand my health. Talking about it is nothing to be scared of. I'm looking forward to going next year.
I would recommend everyone to go for an annual health check if you're eligible to, so you can live the healthiest life and be the best version of yourself.
Don't be afraid to go for an annual health check. It changed my life and it can change your life.